Hi everyone, good evening. Welcome to my channel, Tutorials Abram. Kindly subscribe and like. So today I'm going to quickly talk about two common conditions affecting the thyroid gland or affecting the body called hyperthyroidism and the hypothyroidism. So I'm going to start with hyperthyroidism. What is hyperthyroidism? Hyperthyroidism is basically a disorder, a condition where the thyroid gland produces excessive levels or excessive amounts of thyroid hormones. So particularly talking about thyroxine, T4 or tridothyronine, T3, and reverse tridothyronine, RT3. Okay, so first let's quickly revise our physiology and anatomy. So basically we have to understand like how the body secretes these hormones. So the hypothalamus, the part of the brain, stimulates the pituitary gland, which releases two hormones, thyrotropin releasing hormone and the thyroid stimulating hormone. So they cause this hormone stimulates the thyroid gland to release thyroxine and triiodothyronine. So these hormones, they play key roles in various system of the body. So they're involved in regulation of metabolism. They increase what we call basal metabolic rate. They also produce heat. Yes, so when it's cold, yes, the hypothalamus plays a role. Yes, through all this cascade or pathway causing the release of heat. That's why those with especially hypothyroidism, usually they are feeling cold. So they also play a key role in growth and development, in heart and muscle function. That's why in hyperthyroidism there is a palpitation because there are high levels, bone maintenance, digestive system, reproductive system, and mental health. What are the causes of hyperthyroidism? So causes of hyperthyroidism. So number one, or A, we have what we call Graves' disease. So Graves' disease basically is an autoimmune disease or disorder, autoimmune, and a disorder where antibodies stimulate the thyroid to produce too much hormones. So there's release of antibodies. So autoimmune, so the immune system fights the thyroid gland, in simple terms. So instead of protecting it, it releases antibodies, yes, which stimulate the thyroid gland to release these hormones, thyroid hormones. We have also what is called toxic multinodular goiter. So that grows on the throat, common goiter. So this can trigger hyperthyroidism. We also have what we call the thyroiditis, which is this is basically inflammation of thyroid gland. So this is the inflammation of thyroid gland. So this can cause release of stored thyroid hormones. The other cause, you can say excessive intake. This is the excessive intake of iodine. You know, iodine is can cause increased thyroid hormone production. So iodine is involved in the production of thyroid hormones. And then even medications such as amiodarone. So this is amiodarone. This is a potassium channel blocker, commonly used in arrhythmias, a condition of the heart. This is basically abnormal heart rhythms. Yes, so amiodarone can cause acute hyperthyroidism, but I doubt if it's very common. The most common is grave disease and the goiter, even thyroiditis. So what is the pathophysiology? So pathophysiology is basically there's increased thyroid hormones, elevated levels of thyroxine, T4 and tridothyronine T3, enhance metabolic processes, and then there's a disruption of feedback mechanism. If we remember, hypothalamus stimulate the pituitary gland, which releases thyroid stimulating hormone, stimulate thyroid gland to release these hormones. So sometimes when they reach, normally after they've been produced, there's a feedback mechanism whereby there are signals which are sent back to the hypothalamus, so it stopped stimulating this, so the pituitary gland will stop stimulating, will stop releasing the thyroid stimulating hormone. So in hypothyroidism, this feedback mechanism is disrupted. So as a result, there are abnormal levels which are produced. What are the clinical signs or clinical presentations? I like using that presentation. There is a weight loss in hyperthyroidism, weight loss. There's also increased appetite because of increased basal metabolic rate. So there are increased metabolic process as a result. You want to eat a lot. Then there's heat intolerance. People may feel very hot. Very important. Palpitations, very common. Palpitations, even tremors, even goiter, that growth on the throat. So in terms of diagnosis, so they can test for thyroid stimulating hormone. Usually is low. And then there's the elevated T3 and T4, and then they can do imaging studies such as ultrasound or ultrasound. This is done to detect. Nodules. And then they can do what is called radioactive iodine intake test, common as the RAIU. How do we management? So what are the goals? To basically decrease production of T3 and T4 thyroid hormones, in short. And then number 2, to manage the symptoms. So this will improve quality of life. So what are the drugs? So the first class is a drug called anti-thyroid drugs. So first group, we have methimazole, carbimazole, and also we have propylthiouracil, P2. These are called anti-thyroid drugs. Anti-thyroid drugs. So these they are usually referred as the thionamides, methimazole and carbimazole. Yep. Yeah, including propylthiouracil. So these drugs are commonly used. They're commonly used, and then I want to quickly talk about their mechanism. So methimazole is commonly known as tapazole in the US. Tapazole. They basically inhibit the thyroid peroxidase enzyme. Thyroid peroxidase enzyme, and then blocking the iodination of tyrosine residues. So this will lead to the blockage of iodination of tyrosine residues, residues in the thyroglobulin, thyroglobulin, and this will cause the inhibition. This causes the inhibition of the synthesis of thyroid hormones. So there won't be synthesis of T3 and T4 RT3. So there is inhibition of the synthesis production. Propylthiouracil, commonly known as PTU, inhibit thyroid peroxide enzyme similar to methimazole and carbimazole, thus blocking the synthesis of T3. Additionally, so it has a similar mechanism of methimazole and carbimazole. So it has also an additional, effects. So it basically prevents so it inhibits peripheral conversion of T4 to T3. So they say T3 is the active form. Yes. So in terms of doses, methimazole usually is started at 10 milligram after 10 to 30 milligrams per day, and then maintenance dose can be given between 5 to 15 milligram per day. So this is a chronic condition. So imagine those with Graves' disorder, they take for life, I think. And then for propyluracil, initial dose for this one is usually 100 to 150 milligram TDS. Maintenance, actually they give between 50 to 300 milligram per day in divided doses. And also the other group who drug beta blockers are given beta blockers. Usually the drug of choice is propranolol. So propranolol is a beta blockers. This is a non-selective, so it binds to different receptors of beta, different B receptors. So it's usually started at so this is given to basically manage palpitations and the tremors. Yep. So and then yeah, so can be started at 20 milligram. Yep, can be given up to doses above 100 milligram, but for maintenance they prefer use 40 milligram once or BD. Yeah, they can adjust accordingly. So also they can do what is called, they can give a therapy known as a radioactive iodine therapy. So they can give a single dose between 10 to 15 mCi to abrade thyroid tissue, to abrade thyroid tissue. Yep. And then sometimes if there's no improvement, they can do surgery. Surgery usually is the last resort. Usually last resort, because if they remove now, you'll be taking those drugs for life. So they can do a surgery known as thyroidectomy. So thyroidectomy is basically the removal of thyroid gland. So in cases of goiter, or maybe there is malignance, tumor, they can do this surgery. Yeah. And then in terms of side effects of those drugs, so methimazole, so you have to be aware of these side effects. It usually causes rash. It can cause agranulocytosis, even hepatotoxicity. So if a patient is put on methimazole, they have to do periodical liver functions test. Yep. So they can check for transferase enzymes if they're elevated. The elevation of this enzyme could mean that there is ongoing hepatotoxicity. So for propylthiouracil, it can also cause agranulocytosis and is hepatotoxic as well. So radioactive iodine, it can cause hypothyroidism, radiation thyroiditis, and then usually when it comes to propranolol, it can cause cord extremist, it can cause bradycardia, which is low heart rate. It can cause hypotension. They have to monitor the high blood pressure. Also can cause fatigue. These are common. This is what I add for you for hyperthyroidism. Subscribe to my channel and God bless you.